New tonight, a group of more than 40 epidemiologists and public health scientists from around the world say they reject closing economies to slow the spread of COVID. And they're calling the idea the Great Barrington Declaration. The doctors say, quote, current lockdown policies are producing devastating effects on short and long-term public health. The results, to name a few, include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health. Now, since their declaration, about 40,000 doctors have signed this petition, so to speak, in support. Today, I spoke with the co-authors of this declaration. Dr. BHATTACHARYA is a professor of medicine at Stanford. His research focuses on the health and well-being of vulnerable populations. And Dr. Martin KULLDORFF is professor of medicine at Harvard and Brigham and Women's Hospital. He's also developing new statistical and epidemiological methods for disease surveillance. Doctors, welcome. You have what is being called by critics a, quote, radically different approach to managing this pandemic. Instead, you say we should approach COVID-19 with focus, protection, and herd immunity. Can you explain your recommendation and also the science behind it?
Well, it's not radical if you compare it to the various pandemic preparedness plans that had been prepared before 2020, before we had the pandemic. So everybody can get infected, but the risk of mortality or death is very, very different by age. So the point is that we have to do a better job protecting the old among us. In nursing homes, people living at home, older people who are about 60 are still in the workforce. While there's no public health reason to keep schools closed from in-person teaching, and young adults should live their lives near normally, because for those groups, the collateral damage done by the lockdowns is much bigger than the risks they face from COVID-19.
Politics have impacted the debate about how we should be handling this virus. You have been accused of practicing, quote, Trumpian epidemiology. I'd like to get your reaction to that claim.
I don't think there's any such thing as Trumpian epidemiology. There's just epidemiology. And what we're proposing is actually a call to return to traditional public health. Traditional public health involves thinking about people holistically. We shouldn't just be thinking about infection control in isolation. We should be thinking about health as a whole. People need more than just to be not sick with COVID. They need to be healthy in many, many other ways. And focused protection basically calls for a return to that. If that's Trumpian epidemiology, then so be it. But I don't think so. I think what it is traditional public health applied in this extraordinary setting.
Critics say your approach will result in more deaths and is downright dangerous by doing those things. Dr. Anthony Fauci has also called herd immunity total nonsense. So I'd like to get your response to those critics and also your colleagues in the medical community with these recommendations.
It's either zero COVID, which at this point is utterly impossible, or herd immunity. So there's no strategy about herd immunity that's unique to us. And the current policy, as Martin said, imposes enormous costs on the non-vulnerable, younger people, and even people under 60, I'd say, who don't have some comorbid conditions.
It's very strange. I'm a native of Sweden, and I have defended the Swedish government's approach to keeping the schools open, and Sweden has a socialist government. So I've defended the socialist government of Sweden, as well as I have defended the Republican governor of South Dakota and Florida, who also wanted to open schools. So I guess depending on where and when, I'm either a raving socialist or a right-wing fanatic, which is sort of kind of rather strange and curious.
Okay, let's say we send kids back to school. What does that setting look like?
So Sweden was the only major Western country who did not close the schools during the height of the pandemic this spring. So all daycare and schools were open for children ages 1 to 15. And there are 1.8 million children in this age group in Sweden, and of these, exactly 0 died from COVID-19 during this time period. There were a few hospitalizations, but so clearly it's safe for children to go to school in person. The students did not practice social distancing. They did not have masks. What they did was, if a child had symptoms of a cough or runny nose, they were told to be home and they were sent home. I think the single most important thing that we need to do is open the schools for in-person teaching, letting the children have the education that they need. That's important for education, it's important for their physical and mental health, and it's important for their social development.
And if we don't move forward with the recommendations you both are suggesting, how much worse do you believe it will get?
I mean, you can already see that we've had 220,000 some deaths to date at COVID. Actually, there's been about 320,000 total excess deaths relative to previous years. That's 100,000 extra non-COVID deaths from the lockdown. I think we need to move the strategy because we're harming both people who are vulnerable and non-vulnerable. Getting a direct estimate of that is very difficult. As you've seen also, the forecasting models have not performed very well. So when people give you a forecast and they say this is a certain number, how many people are going to be infected before you hit the herd immunity threshold, there's a lot of scientific uncertainty around those numbers. Not just statistical uncertainty, but fundamental disagreement among scientists about how many people really would you need to get herd immunity, how many before the disease ends. What isn't uncertain, which is absolutely with complete scientific agreement, is older people and some folks who have chronic conditions are vulnerable. And younger people are much less vulnerable. There are fewer kids that have died of COVID this year than the flu this year. So that's not uncertain. The only question is what the right strategy, what the right thing to do with that information.
Well, we certainly are in a challenging year, 2020 to say the least, and the great Barrington Declaration has sparked another conversation in how to get back to normal and save as many lives as possible. So Dr. BHATTACHARYA and also Dr. KULLDORFF, I appreciate your time, I appreciate your insight. Thank you both for talking to us here on News Nation.
Thank you.
And I will add that this interview went on for 30 minutes. I asked them about masks several times because they were a bit ambiguous about wearing masks. And of course, that is an important part of the discussion moving forward. That full interview is on newsnationnow.com. Also giving you both sides of the story. As I brought up in the interview, many oppose this line of thinking. The Director General of the World Health Organization says, quote, herd immunity is achieved by protecting people from a virus, not by exposing them to it. Never in the history of public health has herd immunity been used as a strategy for responding to an outbreak, let alone a pandemic. Going on to say, allowing a dangerous virus that we don't fully understand to run free is simply unethical, and it is not an option. These doctors are advocating a discussion within the medical and scientific community about what to do in an unprecedented time.